5 things you must fix to lose belly fat. Most people think that belly fat is just about eating less or doing more exercise, but in clinic, I see a very different pattern. Belly fat is often the result of how your body is responding to blood sugar, stress, sleep, muscle mass, and daily movement, not just calories alone. In this video, I'm going to walk you through 5 things you need to fix if you want to lose belly fat in a sustainable way. And if you stick around to the end, I'll also talk through one bonus factor that I see all the time that stops belly fat from shifting, even when people feel like they're doing everything right. Number 1, if you want to lose belly fat, you need to stabilize your blood sugar. When blood sugar rises quickly and crashes frequently, the body is repeatedly pushed into fat storage mode. This storage tends to happen around the abdomen because belly fat is closely linked to insulin levels. This is why people can be active, eat reasonably well, and still struggle with belly fat if meals are irregular, very sugar heavy, or highly processed. See, the body is constantly being told to store energy rather than release it. When blood sugar becomes more stable, insulin levels settle, appetite becomes easier to manage, and the signal to store fat centrally starts to weaken. Number 2, losing belly fat requires managing stress, not just food intake. Chronic stress raises cortisol, a hormone that has a very specific effect on fat storage. Elevated cortisol encourages fat to be stored around that midsection, even when calorie intake hasn't increased. I see this so commonly in clinic when people in high pressure jobs come to see me. They're eating fairly sensibly, sometimes even exercising regularly, yet their belly fat remains stubborn. When stress levels stay high for months or years, the body prioritizes energy storage around the abdomen. As your stress calms down, your cortisol levels reduce and the body becomes more willing to release fat from the waist. Number 3, sleep quality has a major influence on belly fat. Poor sleep disrupts hunger hormones, making people more prone to cravings and overeating the next day. It also raises cortisol, again pushing fat storage towards the abdomen. I've seen people make no significant changes to their diet at all, but once their sleep became consistent and restorative, belly fat began to reduce. That's how strongly sleep influences fat distribution. When sleep improves, appetite signals normalize, stress hormones settle, and the body becomes more metabolically flexible. Number 4, to lose belly fat, your body needs enough muscle mass. Muscle helps the body handle sugar efficiently and increases how much energy you burn at rest. When muscle mass is low, more energy gets diverted into fat storage, particularly around the waist. This is why people who only focus on dieting often struggle with belly fat long term. Without any muscle, the body has fewer places to put incoming energy safely. Building and maintaining muscle isn't about appearance. It's about changing how your body processes and stores energy on a daily basis. Number 5, daily movement plays a bigger role in belly fat than short bursts of intense exercise. See, long periods of sitting slow down fat metabolism and worsen insulin resistance, even in people who exercise a few times a week. The body responds better to frequent movement than to occasional intensity. I often explain that walking regularly throughout the day can have a greater impact on belly fat than pushing harder in the gym once or twice a week. You see, when daily movement increases, insulin sensitivity improves, stress reduces, and fat becomes easier to mobilize from the abdominal area. And here's the bonus fact I promised earlier on. Chronic undereating can actually block belly fat loss. I see this so often in clinic. People are eating very little, training hard, and doing everything right, yet belly fat doesn't shift. You see, long-term restriction raises stress hormones and slows the body down, making fat loss harder rather than easier. You see, belly fat responds best when the body feels supported and safe and not constantly deprived. So, the bottom line is this. Belly fat isn't about willpower or extremes. It's about fixing the signals your body responds to. Your blood sugar, your stress, your sleep, your muscle, and your movement. When these signals improve, belly fat follows. Dr. Derek here. If you found this helpful, please leave a like and subscribe. And as always, I truly care about your health and I wish you the very best.